So what is grief? And when I'm answering this, I'm thinking of the kind of early acute grief that happens right after loss. And really importantly, I want to say it's a natural response. Grief is a normal response that helps us come to terms with life after loss. It very normally includes preoccupation with thoughts about the death and the person who died, yearning and longing and searching for that person. Very normal in the early days and weeks after a loss, and also intense emotion. Very commonly as well, people tend to kind of pull away from their social worlds. I remember a nurse I was working with describing it as cocooning. When we've experienced a big and significant loss, we tend to kind of pull away from our usual routines and habits and activities because we're really consumed with coming to terms with this early loss. And I present this slide because I think it's really important for later on when I talk about prolonged grief disorder, that this kind of intense response after we lose someone is really very normal. These natural responses help us to make sense of what's happened. They help us to seek and elicit support from our community, our friends and families, and the people we're close to. And they also compel us to adjust to life after loss. No one wants to stay in that state of intense emotion and yearning and preoccupation forever. And that kind of early response and the intensity of it really motivates us to want to feel better and seek help. So how does grief impact us? Well, really in all ways and areas of our lives. So physically, it affects our bodies. Very often with new grief, there are changes in appetite and sleeping habits. We sometimes may experience symptoms of the person that we've lost. If we cared for someone who was sick, we may experience and feel those symptoms within ourselves. And I think also important to say we're more vulnerable. As we're grieving, our immune systems are challenged and more vulnerable to all the common bugs that are coming around. Behaviorally, grief impacts us by very often compelling us to find and form new habits and routines to our daily lives. It may cause us to, for example, I think of so many people who've lost their life partners and how difficult mealtime is at dinner time. And so they'll sit and watch TV, watch the news with their dinner instead of alone at the table. So very often changes in behavior and routines. People can have experienced changes in their thoughts. They're very often after an important loss are thoughts of what if and why did this happen? And if only I had done this differently or asked this or said this. So again, those kind of preoccupying thoughts, very normal. But also it's normal for people in early grief to be disorganized and forgetful and distractible. The kind of getting in the car to go get groceries and finding you're in a completely different place than you thought you were heading to, that sort of absent-mindedness, because again, we're preoccupied with thoughts of the loss. Changes in feelings and really can happen both ways too. I spoke in that last slide about intense feelings, but also a sense of numbness and shock, very natural and normal in early grief. Changes in relationships, and that can be, again, that kind of cocooning and pulling out of the world as the person early on is trying to make sense of what happened and what it means, but also changes that happen that are sometimes experienced as secondary losses, where we discover people that we thought would be there for us or could be there for us aren't, and others that we never expected to be good supports coming forward. So very often there can be changes in relationships soon after loss. And then this last one, grief impacts our sense of faith, our how we kind of make sense of the world. So changes in our sense of purpose and meaning and values and what's important to us. It's not unusual for people after loss to have a crisis of faith or feel challenged about their faith beliefs, and also to feel isolated and struggling with how to stay connected to their faith community if they're grappling and wrestling with questions about, for example, if there is a God, how could my son have died? How could this have happened? So those kinds of impacts that really hit us in all layers and areas of our life are very normal early after a loss has happened. Grief disorder. What is it? It follows the death of a close person. So prolonged grief disorder is only about bereavement related to the death of somebody. It's not about job loss. It's not about illness, as it lives in the DSM. It's characterized by pervasive and persistent longing and preoccupation with the person who died and or with the death event. So it can be about who the person was and how they mattered, but it can also be about how they died. It very often is characterized by intense emotional pain, so disabling pain. I think of a bereaved mom who I met who said, this hurts so much, I can't even breathe. And we've probably all seen and sat with people who've had that kind of loss. For an atypically long period of intense grief, the DSM now is saying at least 12 months since the loss for adults. So we don't say somebody has disordered grief or prolonged grief disorder until it's been after 12 months since the loss. And again, what's important about that is when you think back to my slide about what is normal grief, in the early weeks, days, and sometimes months after a loss, intense emotion, preoccupation, disordered thinking, very normal and natural. We've suffered something terrible. We're in a lot of distress and we're trying to make sense of it. So when we're talking about a mental health disorder, we're talking about at least 12 months since the death happened. And again, that exceeds what would be expected from within that person's social, cultural, or family circle or religious norms. So something out of the ordinary, where very often the person themselves, but also the person around them is thinking, I don't think this is normal. I don't think this is what we should expect. And significant impairment in important areas of life. So socially, maybe not seeing anybody at all anymore, not able to work, not getting up and feeding themselves and getting dressed. So really pervasive, intense impairment. What I really want to stress as I talk about prolonged grief disorder that gets very much confused even within healthcare professionals is prolonged grief disorder is based on a set of diagnostic criteria. It is not based on context. So just because somebody's had, for example, multiple losses, that does not indicate that they have prolonged grief disorder. Or if someone has been through a particularly violent or traumatic death, that doesn't automatically categorize them as having prolonged grief disorder. They really need to meet a specific criteria set in the diagnostic and statistics manual, the DSM. So common symptoms of prolonged grief disorder, I've touched on this a little bit, and these were finally landed on in March of this year and now live in the DSM. Identity disruption. So a person who's saying, I don't know who I am anymore in the face of this loss. Disbelief about the death. So a person who is kind of beyond that normal, I can't believe it's happened and I'm trying to make sense of it, but kind of long-term disbelief. This cannot be true. This is not true. Avoidance of reminders, either of the person who's died or of the loss. So a person who kind of goes out of their way to avoid things that make it evident for them that the person is gone. Intense emotional pain, we've talked about a lot. Difficulty moving forward. And I would say also difficulty imagining moving forward. Like, I can't imagine that life is ever going to be any better. I can't imagine that I would be back at work. I can't imagine enjoying things again. Or on the other hand, of intense emotional pain, numbness, like really feeling nothing. People who say they feel like a zombie, that kind of nothing lands and nothing sinks in anymore. A feeling that life is meaningless, and intense loneliness, a kind of separation and detachment. And again, I just want to remind us all, these are long-term. So you're looking at these kinds of things 12 months past the death. Many of these symptoms are common and to be expected in early grief. So with disordered grief, we're looking for pervasive, persistent expression of these symptoms for longer than 12 months and beyond what we would normally expect. The prevalence of prolonged grief disorder, according to current research, is that about 10% of adult bereaved people will experience prolonged grief disorder or disordered grief. And that's of all types of losses. So this one says of natural causes, but also generally in the general bereaved population, we're saying about 10% of bereaved people experience disordered grief. I would suggest anecdotally from my experience and also this systematic review that I'm quoting here from Niemeyer and others, I think this is likely much higher for people who are bereaved following a violent loss, like an accident, a car accident, a suicide, a homicide, or a disaster. And I think particularly now of the toxic drug crisis that we have in our country and in the world, I think we're going to see more prolonged grief disorder. And in fact, we are in that population. And I also have some thoughts about prolonged grief disorder in people who've lost someone during the COVID pandemic, where there have been a lot of visiting restrictions and isolation for both the bereaved person, but also separation from our people who are dying. What is best practice? I mean, as far as kind of research and evidence-based goes, I think we're still pretty new in this world. I've put up a bunch of different articles here that I think are particularly relevant and interesting. And I put a kind of highlight around the one in the center. And so the Center for Prolonged Grief at Columbia University, I think is the furthest ahead in terms of studying what is prolonged grief disorder and putting forward an evidence-based approach to treatment. This is the training that I have done at Columbia University in prolonged grief disorder therapy or treatment. And it really is the approach that I think has the most evidence and research behind it. So I've kind of highlighted that, but there are new ones coming forward, and I think it's really important. I mean, I don't know that I'll still be working in this field at that point, but in 10 years' time, we're going to have a lot more ways to approach prolonged grief disorder. And I think we're kind of in our infancy here, but you'll see Birgit Wagner in, I thought she was in Denmark, it's saying here, Switzerland, is doing an internet-based intervention for complicated grief. It's a writing group. CBT has come forward as a useful approach to prolonged grief disorder, and CBT being cognitive behavioral therapy. And also this neat article coming out of Germany around present-centered therapy. So really working with people with prolonged grief to focus on right now, not the past, not the future, but right now, and how to feel better right now. So I think there are some really interesting new approaches coming. I'm the most familiar with the complicated grief treatment that comes from Columbia University. And they do a lot of workshops and education and research. So if anyone's interested to know more, have a Google of the Center for Prolonged Grief Disorder at Columbia. So I'm going to spend a little time now about what helps families at time of death. I'm thinking that some of you might be the people who respond when a death has happened in your community or as part of your role in healthcare. And I also have another bit about what helps people in bereavement. So very quickly, some key considerations. I think I've just got 3 here. What helps people is to understand that families respond in all kinds of ways to loss, and that a particular family unit will have individuals who maybe don't come at this in the same way, and that can be a very difficult thing between family members, where one person is, sobbing and on the floor, inconsolable and doesn't want to eat and drink, and one is, let's just keep going normal. Let's, make dinner, make the beds, get dressed, go for a walk. When people are within a family unit and experiencing and expressing their grief very differently, that can be really hard. And so I think as people who support those who are grieving, that it's important that we acknowledge and support that there's a wide range of normal, and that normal can include emotion, but it can also include being very practical and task-oriented. Very simply, it's part of our role, I think, to normalize difference. Also to encourage and support people to talk about what happened. That whole kind of making sense is really important soon after a death happens. And so if you're one of those kind of first visitors or first responders when a death happens, to really kind of move slowly and give people time and space to process. So invite them to talk about the death. What happened, what stands out for you? What are the questions that you have? What's sticking in your mind, or what are you finding rubs, the most painfully, and give people a chance to kind of just process what's happening. Again, you don't jump in with a list of big questions and you're not hammering away at people, but really to invite what's going through your mind right now? What are your thoughts? What's happening? And after death details, depending on the setting and the circumstance of the death, whether it's a surprise and an accident out in the community or in somebody's home, or whether it's in a healthcare facility, to really take a moment to stop time and check in with people about all the things that need to be done. Very often there are people to call and things to do and decisions to make. And so I think of this as whether you're a kind of friendly visitor, a volunteer or friend, or whether you're a professional, to offer to get practical, to help people to stop and think about what needs to be done. Are there people that need to be called? Are there decisions that need to be made? Are there places that we need to go? And for you to offer yourself really practically, like, I can find the phone number for that funeral home, or is there anybody that you want me to call and ask to come and be with you? So very kind of practical, concrete things. And then lastly, the importance of ritual or ceremony, whether it's a funeral or whether it's time of death in the hospital at the bedside, to really invite people to take time to think about, is there anything important that they want to say or do before they're separated from the person who died? Maybe it's a goodbye, maybe it's time alone. Oftentimes it could be just to sit beside the person and say the things that you wanted to say, or maybe didn't get to say, or need to say some more. So really kind of to make space for important things. I'm an old child and youth care worker, so I lean on these kinds of things, but I think they're meaningful for adults too, which are like linking objects. Is there a little note, a little love note that you want to tuck in the hand of your person before you leave? Or is there a special object, a teddy bear or a piece of jewelry or something that you might want to leave with your person or have them buried or cremated with? So, really looking for ways for people to personalize their ways of honoring the person who's died and thanking them. I think it's Harvey Chochinov that's got his, is it Chochinov, or it might be, I'm seeing his name, but I can't say it, but, 4 things that matter. I love you, thank you, forgive me, and I forgive you. Is there time and space for people to be able to do that, whether it's through words or through actions? I'm going to talk a little bit here about what helps people in bereavement. This is the most important slide. Carl Jung. Know all the theories, master all the techniques, but as you touch a human soul, just be another human soul. I think we often underestimate the power and importance of just being another human being who's able to sit with another human being who's suffering. So I remember coming in to do some volunteer training at my hospice, following on the spiritual health person. And just as he was wrapping up, he was saying, stop worrying about what you're going to say and having all the right words, and just think about how you're going to be. Bereaved people have had a shock very often. They're grappling with something that feels impossible and unwanted to be true. So just to be present, to breathe, to listen, to open space is so important.